Hello, ladies and gentlemen, and welcome to another edition of Perspective 254. My name is Ojeliche Kesa. As usual, before we get started, I would like to implore you to please, just go down there. If you have not done this already, go down there, click the subscribe button, and then come back. Let us do the show. Today on the show, RutoCare. That is Kenya's very own version of Obamacare. You're all familiar with that, right? Officially, it is actually called the Universal Health Coverage, or in short, UHC. In a different world and a very different set of circumstances, I will be talking about Babacare. But, mulipiga kwenda venye mulipiga, and so we now have RutoCare. And that is what we're here to discuss tonight, RutoCare. Anyways, back to my story. A few days ago, President Dr. William Ruto signed into law 4 separate bills that together constituted what is called the Universal Health Coverage Law, also known as the RutoCare. Under this new RutoCare law, the president seeks to lay the foundation for the biggest change in healthcare system in Kenya since independence. At the heart of this healthcare law called RutoCare is actually a powerful idea. The idea is every Kenyan, no matter their financial standing, should be able to access healthcare services that they need without the looming threat of financial catastrophe. This concept is actually a revolutionary concept, particularly for the lower income families, for whom medical expenses can be debilitating sometimes. RutoCare consists of 4 separate healthcare bills, all part of his grand plan to revamp universal health coverage in Kenya. The 4 bills of RutoCare are the Primary Healthcare Act, the Social Health Insurance Act, Digital Health Act, and finally, the Facility Improvement Financing Act. Those are the 4 parts that make up what is called RutoCare. Now, let's try and break this down into bite-sized pieces, starting with the primary healthcare, which is the first component of RutoCare. This is actually the heart and the very core of RutoCare, or United Health Coverage implementation. Primary Healthcare Act addresses the current healthcare imbalance in Kenya by emphasizing on preventative and promotive health services in the country. The Act introduces a framework for the effective delivery of primary healthcare services through networks that include all healthcare providers, whether they are public, private, or faith-based providers, to shift from a system that is obsessed with treating illnesses to one that is actively championing disease prevention and wellness right down to the community level. It's not just about slapping on band-aids on sicknesses anymore. It is a holistic approach focusing on everything from health promotion to disease prevention, treatment, rehabilitation, and even palliative care. If I'm understanding this correctly, the whole idea here is pretty much prevention is better than cure kind of model. And if that's indeed the case, then kudos to Dr. Ruto. Hapo ameweza. You are onto something. So the question is, how exactly does he plan to pull this off? Well, Dr. Ruto is not just crossing his fingers, and hoping for the best, like normally that's what happens in politics. Here, there's going to be a trained and equipped workforce with plans to hire over 100,000 community health promoters within the country. Next up, we have the Facility Improvement Financing Act, because the Kenyan health sector has always been dogged by allegations of fund misallocations and misappropriation, and this is exactly where the Act steps in. The Facility Improvement Finance Act will provide for an excellent, secure, and accountable mechanism for the collection, retention, and management of revenue that is derived from health services throughout the country. It is all about ensuring that the money that is collected is actually spent where it is needed the most. And then we have the Digital Health Act, which is the 3rd act of this Ruto law. I just imagine a world where your health records are actually a click away. Just like that. That is what this act is aiming for. A comprehensive and integrated health information system, all at your fingertips. The system will manage the core digital systems and the infrastructure required for its seamless health information exchange throughout the country. It is healthcare for the digital age, folks. And finally, we have the Social Health Insurance Act. Now, this one is tackling a very, very, very hard truth in Kenya. Most Kenyans are just one illness away from poverty. Basically, you get sick and that's it for you. The Act sets up a prepaid system that aims to shield Kenyans from crippling out-of-pocket expenses when they visit a hospital for treatment. Dr. Ruto has made it crystal clear that his administration is all about transforming the healthcare landscape in Kenya. Under the new law, Kenyans will just be able to walk into any hospital and receive quality treatment. And they will do so without the fear of financial despair. The new social health insurance law has also repealed the current National Health Insurance Fund, NHIF, and established 3 new funds in its place. The first one is called the Primary Healthcare Fund. The second one is called the Social Health Insurance Fund. And the third one is called the Emergency, Chronic, and Critical Illnesses Fund. 3 different funds are in the place of NHIF. These funds will ensure a publicly funded primary health care, emergency care, and universal health insurance, while at the same time promoting equitable access to quality health care for all. Now, the Primary Healthcare Fund will finance services from health facilities at levels 1 to 3, while the Social Health Insurance Fund will cover services at levels 4 to 6 facilities. The Emergency, Chronic, and Critical Illness Fund will fund emergency and chronic illness costs once social health insurance is depleted. This is a seismic shift in our healthcare system, a complete overhaul in how healthcare is accessed and delivered in the country. This is basically tearing down the financial barriers and building a system where the quality of care you receive does not hinge on the size of your wallet. According to Dr. Ruto, healthcare will no longer be based on your ability to pay, but on the health needs of every Kenyan. Dr. Ruto is looking at the current system in Kenya and pointing to the bizarre setup where low-income earners have, in essence, been subsidizing their wealthier counterparts. And that is about to change. With the Social Health Insurance Fund, it's all about equitable contributions, a fair system where payments are actually income adjusted. So, there you have it. We have 4 different acts and 1 monumental goal, transforming healthcare in Kenya. But, as with many things this ambitious and this sweeping, there's obviously questions and concerns about the whole thing. There are, as expected, potential upsides and downsides to this very initiative. And it is important, really, really important, that we try and unpack both sides of the coin. On one side of the coin, the good side, the upside of the coin, basically, RutoCare is steering the healthcare system in a whole new direction in this country. Instead of focusing solely on treating illnesses, there is a substantial emphasis on preventive measures. It is not just about healing the sick anymore. It is about health education. It's about routine checkups, and it's about vaccinations to keep people healthy in the first place. This proactive approach is actually a fundamental shift in how we think about healthcare. It is about maintaining wellness, not just curing diseases anymore. The initiative also heralds the digitization of health services in Kenya, thereby making a significant step into the future, because the future is digital. With the digital health records, patients can expect faster and more efficient care from hospitals. The days of lost paperwork and having to recount your medical history over and over each time you visit a doctor, those days are gone. Now, we have a comprehensive medical history available at the click of a button, making healthcare more efficient and less cumbersome for everyone involved. And the impact of RutoCare at the community level is also particularly notable, with the deployment of 100,000 community care workers to help this initiative. These healthcare professionals are not just workers. These are basically your neighbors, these are your friends, and even so in some cases, they are relatives. People are living within the community that they serve, providing basic care and educating people about their health. It's a more personal kind of healthcare, one that is embedded in the community. And finally, the Facility Improvement Finance Act under RutoCare is setting new standards for accountability. It's not just about funneling funds into the healthcare system. It is about making sure that every shilling is actually used to improve services as expected. This level of oversight is unprecedented and crucial, ensuring that funds allocated for healthcare are actually used responsibly and effectively, directly contributing to better health services for all Kenyans. Having said that, on the other side of the coin though, the introduction of the new health fund initiative has been met with significant public skepticism and concern from the people. There is a prevailing trust deficit among the people of Kenya, stemming from fears that these new funds will be misappropriated as were previous ones, vanishing into the abyss of corruption. Rebuilding this lost trust is a daunting challenge that authorities must confront head-on. Moreover, the implementation of this initiative is actually nothing short of a massive overhaul that presents substantial challenges. Aligning infrastructure, human resources, and technology, this transformative endeavor is a daunting task. On the financial front, this new policy dictates that workers contribute 2.7% of their salaries towards the fund. Despite its noble intention of financing healthcare accessibility, this mandate is essentially a deduction from the earnings of individuals in an already strained economy. This makes it an unpopular measure among the people. This initiative's primary goal is to render healthcare more affordable and accessible, particularly for the underprivileged. However, the reception among the Kenyans is far from welcoming, because they perceive these as nothing more than a new form of taxation, which is a deviation from Dr. Ruto's promises to alleviate financial hardships. This skepticism is further fueled by the shadow of corruption haunting the existing health fund, leading to apprehensions about investing their hard-earned money into a potentially futile system. Despite this protest and widespread distrust, the plan is actually moving forward, albeit amidst an atmosphere of contention and uncertainty. As we delve into the complexities and aspirations of the RutoCare program, it is imperative to explore deeper insights and pose critical questions, and the kind of questions that highlight the multifaceted nature of this healthcare initiative. For one, how will the government address the public's concerns regarding financial obligations associated with RutoCare? Two, is there a comprehensive strategy in place to educate Kenyans about the benefits and workings of RutoCare? What measures are being taken to ensure smooth rollout of RutoCare, especially in the rural areas? And how will the program safeguard against potential corruption or mismanagement of the funds, especially considering previous unsuccessful attempts at healthcare reform in this country? And what makes RutoCare different from these previous attempts, and how does it plan to sustain itself in the long run? Will there be a continuous assessment and reform strategies to ensure RutoCare adapts to the evolving healthcare needs of the Kenyans? Those are only a few of the tough questions that we need to be asking ourselves as we get into this new healthcare system that is called RutoCare. Now, the launch of RutoCare marks a pivotal moment in Kenya's healthcare sector. It offers a beacon of hope for enhanced access to medical services across the population. RutoCare stands as a potential game changer in achieving universal health coverage in this country. But its longevity and efficiency will depend on continuous evaluation and willingness to adapt and reform as necessary. The nation's healthcare actually lies in the balance, and the collective effort and resolve of all stakeholders will determine the trajectory of this ambitious healthcare initiative. It has the potential to rewrite the script for healthcare in Kenya. I do remember someone, I think it was Senator Edwin Sifuna. At one point, he described the Kenya Kwanza government as serikali ya pata potea. Now, in this case, I think in this initiative here, Kenya Kwanza wamepata. Hii si kupotea, wapo wamepata, and hopefully wananchi pia watapata. Fingers crossed. We can only hope that no one actually ends up stealing all the money that is meant to execute the whole thing. This has been Perspective 254. Stay healthy, stay informed, and till next time, cheers. Cheers.